welcome. This is Claire with Local Business News Self. I'm here with Dr. Patrick Smith, who is a general practice dentist and has been seeing patients in Birmingham and surrounding areas for over 30 years. So welcome. Thank you for being here today.
Thanks for having me.
Yeah, we're excited to talk about dentistry and what you do. So the first thing I wanted to talk to you about was I think some people think of their oral care separately from their general health, but how is dental health connected to a person's overall health and wellness?
Yeah, that's a good question. You're right. A lot of people look at the mouth as separate from their entire body when really you should look at it as an extension of your entire body. And poor oral health includes things like gingivitis, which is a bacterial infection in the gums. It's mild, it's reversible, but it can lead to periodontal disease, which is an inflammation of the tissue, and it has bone loss, and it can also lead to tooth loss, and then obviously tooth decay. So beyond your teeth getting yellow and your smile not being as good or having bad breath or things of that nature, it can also contribute to some other overall health concerns. And I've got a few that I've highlighted. One of them is it can lead to, there's a correlation with some cardiovascular disease. So things like coronary artery disease or clogged vessels are associated with poor oral health, as well as we see an increase in strokes in people with poor oral hygiene or oral health, and also an infection of the lining of the heart called endocarditis, which if not treated can be fatal. Along with cardiovascular disease, people that are diabetics, having poor oral health can make it much harder for people to manage their blood sugar levels. And it's interesting because diabetic people, it also makes it harder to manage their oral health. So they kind of feed off of each other in a negative way. Those are the first two. And then another that poor oral health can be correlated with is some issues in pregnancy, where we can see people, women that have severe periodontal disease, we see premature births, as well as a decrease in birth weight and an increase in the number of miscarriages or stillborn babies. And there's also an association with an increased risk of preeclampsia for pregnant women.
Wow, so it really affects everything.
Yes.
Your heart, it can affect, diabetics, it can affect pregnancy. Like it really is not separate.
Right. Absolutely. And it can make it difficult to eat if you have missing teeth or you get pain, but cavities and tooth decay have also been correlated to an increased risk of people getting pneumonia. So those are kind of the systemic issues that our poor oral health can affect.
Wow. Yeah, I had heard about the heart correlation and like the plaque potentially being an issue down the line for your cardiovascular health, but I did not know about the others. So yeah, it's interesting to know that it really does have a full effect on your entire body.
Want to discover the best local businesses in town? At Local Business News, we bring you exclusive interviews, behind-the-scenes looks, and weekly deals straight from your favorite shops and restaurants. From mouth-watering meals to must-have shopping finds, we connect you with the businesses that make your community thrive. Support local, save big, stay connected. Visit Local Business News today and discover the heartbeat of your community.
So what habits beyond brushing twice a day and flossing every day do you encourage your patients to do to maintain long-term dental and general health so that they don't have to deal with some of these issues that could happen down the line?
Okay. So yeah, in addition to brushing twice a day for 2 minutes and flossing effectively to get the plaque off of the teeth, people can eat a well-balanced diet is important, in particular limiting the sugar intake that people have, because sugar, the bacteria that causes tooth decay, likes sugar, and so it increases the risk of getting tooth decay. So fruits and vegetables are good. We want to limit sugary drinks, obviously, sugar containing foods that are especially sticky things, because that can lead to an increase in risk of getting gum disease or tooth decay. Also, tobacco products, whether it's smokeless or cigarettes, cigars, any of those, they decrease the blood flow to the mouth, and it also dries it out, which both of those things can kind of make it difficult to manage oral health successfully. Not to mention, there's an increased risk in getting oral cancer or throat cancer with tobacco products, which many people are aware of. The other thing is, I would recommend seeing a dentist every 6 months minimum. Some people need to see a dentist more frequently if they do have periodontal or gum disease, to help maintain it so that it doesn't get worse. And some people, if it's bad enough, we would have them see a periodontist and help maintain it that way. And the other thing I like to mention to people is it's a good idea to replace your toothbrush every 2 to 3 months, because they get kind of frayed looking and not as effective at removing the plaque in your mouth.
Yeah, those are all really good tips. Do you have a preference between, like, I know electric toothbrushes are really popular these days and not electric. Does it matter if you're brushing regularly? Do you prefer one over the other as a dentist yourself?
Yeah, so that's a good question. If you're brushing with a manual toothbrush effectively, that's fine. But some people, and especially as we age, it can be more difficult to do that, or with crowded teeth. And certainly automatic toothbrushes do help with that. There's definitely some studies that show that it helps increase the efficacy of brushing.
Okay, that's good to know. Something else I was just thinking of when we're talking about flossing. Do you ever recommend the traditional floss over like the picks? I feel like I see those a lot in the grocery store. Do you feel like those aren't as effective, or one's better?
So I've always been a proponent of, if it helps you to maintain your teeth and keep them clean more effectively, whether it's traditional floss or some of the floss holders or the soft picks like you were referring to, if you use them properly, they can help remove any plaque that's on the teeth. And again, I'm kind of, anything that helps people be more effective at keeping things clean, I'm all for.
That's great to know.
Including water picks as well.
Another thing that I just wanted to cover, because it feels like a lot of people I know, they have a lot of anxiety about going to the dentist, either from like the cleaning process, feels stressful, or maybe they haven't been going twice a year regularly and they're, a little embarrassed that they haven't made that a priority, and they're scared to start. What would you say to someone who might be feeling that way?
Yeah, so the one thing I say is, we're not here to judge anybody about what they have or haven't done in the past. I'm not as concerned about how we got where we're at as I am trying to manage that and get it so that things are healthy again and take care of any existing problems. And what I would suggest to people is talk to your dentist about your concerns. Let them know, hey, I'm nervous, whether it's I'm just afraid to go to the dentist because of the potential for pain. I'm afraid of needles. I'm worried about the cost of things. From a standpoint of all of these things, we can talk about it and we can almost always find a solution. If you're really nervous about it, just try to talk and put people at ease, because a lot of times having information and knowing what's going on is half of the battle. And some people are still very anxious in those instances. Sometimes we will give them some type of a pre-medication or something to relax them before their appointment. And then as far as pain goes, we like to try and, use local anesthetic and any other things that we can use to try and make it easier for people. And with the cost of things, we can almost always figure out some kind of a payment plan. But I think the most important thing is to talk to your dentist about it and let them know what your concerns are, and make sure they're listening to you, because some of us dentists can get a little busy and we probably should be better at listening sometimes. Another thing that people can do sometimes is bring a friend or a family member with you to visits. I don't have a problem with people bringing a friend back into the treatment room if it makes them feel more comfortable and helps them to get through the appointments so that they can improve and get their oral health back under control. I'm all for it.
Those are great tips. I totally agree. I mean, you can't help a patient solve a problem if you don't know what the problem is. So definitely important to share concerns ahead of time. And it's nice to hear. I haven't heard someone else say that, you know, bring a friend, bring a family member, because that can definitely be helpful if you're nervous to go, and almost accountability too, right? Like you're telling someone to go with you.
Yeah.
We're going to go.
Right.
So,
right.
Yeah, those are really good tips.
At Local Business News, we bring you the stories behind the businesses that shape your community. Meet the faces who make it happen. Claire highlights the businesses helping you feel and look your best, inside and out. Sarah uncovers the businesses making your home more beautiful, functional, and welcoming. Pam explores the flavors, stories, and passion behind your favorite local restaurants and food spots. Your community, your businesses, your stories. Meet your LBN reporters, covering the heartbeat of your community.
Okay, the next thing I wanted to talk to you about was, I just feel like fluoride has been in headlines a lot lately. And I'm wondering if, you know, some people may be nervous about, should they use it? Should they not use it? We're not really sure. What is the recommendation these days? What do you think? How do you feel about fluoride, and how can you help people who maybe are unsure if it's the right choice for them? Because I feel like it's in toothpaste. It's in, it feels like it's in a lot of dental products.
Yeah. So I am, along with the American Dental Association, Michigan Dental Association, we are all proponents of fluoride in the drinking water and using a fluoridated toothpaste. And in some instances, if you're in an area where there's not fluoride in the drinking water, getting fluoride supplements for infants and children. That's one of the things that they're kind of trying to do away with right now, which I don't agree with. Because fluoride's naturally occurring, and it's, when used at the proper levels, which is 0.7 parts per million. So for every million gallons of water, there's 0.7 gallons, so less than a gallon of fluoride. And at that level, it's safe and effective. And we've seen a decrease of about 50% in the amount of tooth decay since we've fluoridated the drinking water. And not only is there less tooth decay, but the cavities are smaller and more manageable. Fluoride has frequently been considered one of the hallmark public health achievements of the 20th century. It's effective. Some of the recent research that people are looking to, and when they're against fluoride, they're either not well controlled studies, or they're inconclusive. But there have been studies, because one of the things is its effect on neurological development and cognitive development in children. And there are recent studies that show that there's no effect on cognitive development. There's no effect on outcoming the IQ that people have when they're adults if they've had it as children. And there's a couple of pretty good studies that show that. So again, like the ADA and the MDA, I am all for fluoride in the drinking water and in using a fluoridated toothpaste.
It's great to hear. Well. Yeah, and I mean, it's interesting too that you said it's 0.7 gallons to every 1 million too. Like I'm not sure that some of the people who are afraid of it know the specifics of how it's safe, and it's been around for quite a while, hasn't it?
Yes. So the first area to get fluoride in the drinking water was Grand Rapids, Michigan, in the country, and that was in 1945. The greater Detroit area where I am is it's been around since 1969-ish. And so you see the benefit in people that were born in about 66, 67 and more recent, because the permanent teeth don't start to develop till you're about 3 or so. So those people, it's a dramatic difference in the amount of tooth decay. I mean, it's amazing.
I feel like this is one of those things too, like you said, chat with your dentist about it. Like if someone's concerned, it seems like they should chat with who they're seeing and hear about the research. Y'all are the experts. You spend the time reading all of these studies, you know what to look for, and you can have that information to reassure people that it is safe and effective and you use it for a reason. Okay, so if someone in your area is looking for a new dentist, are you currently accepting new patients? And can you just talk a little bit about what services you offer, what patient populations you serve, and then additionally, if you do accept any dental insurance and how people can make an appointment with you?
So yeah, we're always accepting new patients. I don't know of any dentists that aren't, but maybe there are. And I do most facets of general dentistry. We see adults and children. We do cleanings, exams, x-rays. I do some root canals. I do a limited number of extractions, but crowns and bridges and veneers. I restore implants. So we kind of do all facets, which I think most general dentists do the same types of treatments. I've been here at 532 North Old Woodward for 32 and a half years. But we're moving actually in December, about a half a mile away. We're going to move up to 50 West Big Beaver. We're a little tight on space here. I probably should have moved 10 years ago, but I didn't. So
Hey,
we're doing it
now.
But yeah, and I just would encourage people to, especially those that are afraid of going to the dentist or nervous about it because they're worried they're going to be judged, go see somebody and just, let them know your concerns and get things taken care of, because the earlier you take care of things, the easier, the cheaper, the better it is. There's just no question about it.
Being proactive, it seems like, is always the answer. So that's a very good sentiment. Great. Well, thank you so much. I really appreciate your time. I hope you have a great weekend.
Thanks, you too. And thanks for having me.
Yeah. Take care. Have a good one.
Okay. You too.
Bye-bye.
Bye.